their patients safe, the other patients that they see, and to keep their families safe, and to make sure that they're healthy and well enough to stay in the fight and to save all of us. As you know, because of a failure of leadership in this country, there is not enough PPE, there are not enough masks and gowns and gloves and visors and the protective equipment that those healthcare workers need. And so we have to call upon our own intuition and ingenuity and innovation to fill the gap. And a great example of that is Jacqueline Westman, who is gathering displaced garment workers who may be out of a job because of the economic downturn associated with these business closures in the face of the pandemic, and bringing their skills and experience to bear on this pressing challenge that we have in this country. So we're very excited to hear from Jacqueline, and I'll have her on in just a minute. But wanted to give you that good news. Oh, Cynthia, I see it. Shoot. Well, I did pin Project Ppe Act.com, so we didn't get the food bank up. We'll figure this out. But if you want to help the El Paso Food Bank, elpasoansfightinghunger.org. If you want to get PPE to frontline healthcare workers, Project Ppe Act.com. It's pinned at the bottom of this feed. And if you have questions for me or for Jacqueline, there's a little question button right on my screen. And if you ask a question, we'll do our best to answer those. Couple of other things that I want to share. First, let's take a look at some of the numbers. We try to get this updated every time we go live with you all. Just the latest numbers that we have from the Centers for Disease Control, and the Texas Department of Health Services. Globally, we're over 1.3 million cases, and nearly 74,000 human beings have lost their lives to the coronavirus. By all estimations, this is a gross undercount, but is relevant when we measure day to day, week to week, and soon month to month. But it's an indication of how much suffering is taking place due to this virus. In the United States, 357,000 cases. We've now passed 10,000 deaths, 10,524, and we're almost at 2 million tests that have been completed in the United States so far. In Texas, 7,300 cases and 143 deaths to the coronavirus so far, 85,000 tests. One thing that I'll say and continue to repeat, and I think we all need to repeat this, especially to those who represent us in positions of power and public trust in office. We need more tests so that we know who has coronavirus, so that we can help them, and so that we can stop the spread of coronavirus by tracing the contacts that infected person has had, to isolate those people so that they don't infect others in their lives and in their communities. So we need tests. We need to ask the president on down, where are those tests? 2, we need ventilators for those who do have COVID-19 and are unable to breathe on their own. It's imperative that we get those ventilators to those hotspots, those states like New York right now that desperately need them, and then move them as quickly as possible to the next hotspot, because we don't have enough to distribute them to every state evenly right now. So we need ventilators, we need tests, and then we need the PPE, the personal protective equipment that keeps those health workers safe so that they can work on saving all of our lives and preventing the further spread of coronavirus and COVID-19. Texas has one of the lowest testing rates per capita in the nation. It's in the bottom 10. It's not a place that we want to be in a state of 29 million people. So Governor Abbott, President Trump, please make sure that we have those tests. You'll be accountable for how you performed in the midst of this crisis, and it's paramount that we test the people who may have coronavirus so we can stop its spread. Last thing I'll say before we bring on Jacqueline, I saw an article today from Chicago Mayor Lightfoot. We're learning that she's raising a public health red alarm, she called it, about the disparate impact of COVID-19 on communities of color. 70% of Chicago residents who are dying from COVID-19 are African American. The city is 29% African American. This trend seems to follow through much of the country. And I don't have to tell many of you who've experienced this in your lives that it's not just restricted to COVID-19. We see it expressed in maternal mortality deaths, in deaths from heart disease and lung disease, and really anything that afflicts any of us in this country. It is particularly worse in communities of color, and we are certainly seeing that play out right now with COVID-19. So, President, again, on down to governors and mayors, now that we know that, we need to take steps to ensure that those populations are protected, and they have access to the tests and the PPE and the ventilators in their hospitals. Wanted to make sure that we elevate that news or that information so that everyone can act on it going forward. Now, for Jacqueline, who I hope to be able to bring in to this Instagram live, a friend of mine, her name's Luli, sent me a note, and she was talking about trying to have hope. And she said, the way she put it, in a room full of crap, there must be a pony in here somewhere. And for many of us, Jacqueline has been that hope and that reason for optimism. I got to know her in my race for the nomination to be the Democratic nominee for president. She was one of these people who would take on any task, drive any distance, do anything that you asked of her, do everything that you asked her not to do, as long as she thought it was in the best interests of the candidate and the campaign, and did so with an infectious level of fun and energy and humility. Just really one of the most amazing people that I've met. And it should be no surprise to any of us who know Jacqueline that she started an effort to make sure that healthcare workers have that personal protective equipment that will save their lives and by extension, save all of our lives. So I'm going to try to bring Jacqueline on. Drum roll, please. Jacqueline.
Hi.
It's good to see you.
You too.
Are you in LA right now?
I am. I am actually coming to you live from one of the factories in downtown Los Angeles.
Okay, so before we get into Project Ppe, I want to know how you're doing, and I want to know how the people of LA are doing.
Yes, thank you. I am good. I am, just taking it day by day, and I am healthy. My family, my friends are healthy, and even though those who were recently diagnosed with COVID are, recovering. So I am just grateful that that I'm okay, and I'm able to now just, help others right now at this moment in time.
We got to be on a Zoom call this weekend with a mutual friend, Charlie, who lives in Iowa, who had COVID-19 and about whom all of us were worried. And it was so great to see her face and to see Linus, her pet bearded dragon, resting on her chest, and to know that she was okay. And you're right, there's a lot of anxiety and stress, even for people who are not sick themselves or don't have an immediate family member who are sick. And so we want to make sure that we're doing everything that we can for those who need our help, especially if we're healthy enough, well enough, and have the resources sufficient so that we can help people out. And on that note, what are you doing? What is Project Ppe?
So Project Ppe is a group of innovative design fields. And then really quick, those who don't know what PPE stands for, it is personal protective equipment. So this group that was part of creating this so happened to be some of my best friends, Brittany Walker, Diana Lai, Monica Hernandez, and we basically, this all started on a quick FaceTime chat 2 weeks ago. And all of us have been in the industry for over 10 years, and we've used to work together as well. And, we just quickly were just talking about everything that was going on and just, like, what can we do? How do we act? How, we have the resources, we have the network, and what do we need to do? And it was, I think after like that 20-minute conversation, immediately we had sent over a photo to one of my dear friends who is a pattern maker, incredibly talented John Lee and sent him a picture, an image of a gown. And we knew that we wanted to make hospital gowns, knowing that that was definitely a dire need. You know, talking with Deb Jeets and other frontline nurses, and also just going online and seeing the outcry.
Medical workers wearing garbage bags.
Yes.
Right?
Yes. That New York Post was just so heartbreaking. And immediately after we had sent that image, like 2 hours later, John called and was like, your pattern's ready. Next day, picked it up. And on Monday, we were at our very first fabric vendor who was donating over 500 yards of fabrication for us to use for our face mask.
So you mentioned PPE is personal protective equipment. That's gowns, that's face masks. Are you making anything else for healthcare workers, or is it primarily those two pieces of PPE?
Primarily these two. We have had requests for hair protection, for head protection. So we actually picked up a pattern yesterday for that. And a lot of people are requesting like face shields, but that kind of just goes into a whole other element of design. So I think for now, we've really nailed in the hospital gown and the face mask. And, you know, we're really grateful just to see how fast everything has rapidly, come together.
And are you able to tell us some of the hospitals and clinics that have received the PPE that you and your team have made?
Yes. So the past couple of days, we just sent to Kaiser in West LA, Brookdale Hospital in New York, Flagstaff Medical Center in Arizona, and in Flagstaff, they are also housing those who are infected with COVID from the Hopi and Navajo tribes. And so we're really trying to fill the gap that obviously the government is not responding quickly to. So it's those rural community hospitals that often are left behind. But then when we donated to Kaiser, it was, a bit of a surprise because Kaiser's such a big corporation hospital, and the nurses that, were able to accept them were actually part of the NICU for COVID. And so that was just like heartbreaking in general to hear that. We also yesterday had a call with Cuomo's office and the New York Health Department asking, when can we ship our next gowns? So tomorrow we'll be able to send out almost 300 gowns. And today there was another outcry from SUNY in Brooklyn as well. And it's incredibly just overwhelming to know that these hospitals are in dire need. And here we are just, trying to gather all our resources and pump these gowns out as soon as possible.
That's why I love you so much, because I think some of us might stop at anger and frustration and be pissed off, justifiably so, that the wealthiest, most powerful country on the face of the planet cannot even provide face masks and gowns to doctors and nurses on the front lines of the greatest public health threat that we've ever faced. And we may just, tweet something or throw something at the TV or do whatever we do and then just move on with our lives. And I'm sure you were angry at first, but then you took that important next step and said, okay, they're unable to figure this out, but I think I can, or I can with these friends and associates and perhaps some displaced garment workers who have the skills and experience necessary to meet this challenge right now. I'm going to bring them all together and we're going to fill this gap. How many face masks and how many gowns have you all shipped out so far?
So we have made almost 500 gowns and face masks, almost 3,000. So this morning, another vendor who has been so kind and gracious to donate over like thousands of yards, rag finders. I picked up another 1,000 yards. Like my car is like full of fabric rolls right now. So we're hoping by the end of this week, actually, we'll be able to have 5,000 face masks and hopefully, another 300, 400 gowns. we're just going to try to just keep going as fast as we can. Really, right now, because California is on a statewide lockdown, this factory that I am in, who belongs to a dear friend of mine, Mario, who I would love to introduce you just to say a quick hi.
Yeah.
Normally, this factory is filled, there's 4 rows here, and it's, from 9 to 5, this place is, they have work to do. And unfortunately, within the fashion industry, the fashion industry is definitely hurting with COVID happening, and they've had to shut down. And these businesses and clothing companies are no longer, they either were furloughed or they were laid off. So being in the, knowing a lot of these workers, and I know how extremely hard they work, and they all have families, and they're just so grateful to have a job and be able to produce, clothing that helps these local fashion companies. And it's all made in the USA, which is like such a beauty as well. And, unfortunately, because of, with a lot of, just in general in the fashion industry, like these made in the USA companies, a lot of them had to shut down. And so there's only just a few that are thriving. And so being able to help them is something that we're just so grateful for. Yeah.
Jacqueline, I have one other question for you, and then I want to open it up to all the folks who posed a question through the little question button at the bottom of the screen. What are the limiting factors that would prevent you from producing tens of thousands of masks and gowns? Is it a function of money to pay the garment workers who are producing this? Is it a matter of material? And you've mentioned the generous donors who've donated the cloth or the material. Is it workspace? Is it workspace? What do you need to be able to produce more?
We definitely need funding. We have all the manufacturing capabilities, supplies, fabric, trims, and we have the resources. We just need funding. We also are trying to work with Mayor Garcetti's office to try to get permits to open up full time so that we can get at least 7 to 10 employees in here, where we're able to pump out almost 500 gowns a day. And unfortunately right now, their turnaround, even though I'm so impressed and thankful for being able to quickly turn 200 gowns in almost 3 days, knowing that we are about to hit the peak in the next 7 to 21 days is going to be almost like a colossal hell. And we just want to act as fast as possible, but we're also just kind of doing the ask for forgiveness, not permission at this. So it's just, and some other friends who are also helping, they're just like, we gotta do it. We need to work, we need the money, and it looks like everyone in the country needs some help at the moment.
So
there
is a pinned link at the bottom of this feed, and it's the website for Project PPE. It's projectppeact.com. You can make a donation there. And what that does is, as Jacqueline just explained, is it helps to pay the garment workers who are producing the personal protective equipment that healthcare workers in New York, in Arizona, in California need to be healthy and safe so that they can take care of all of us. So really encourage everybody to make a donation. Jacqueline, give me just a second.
Any amount is truly appreciated.
Here you go. Can you see this question on your screen?
Yes.
How much PPE is produced in a day? And how big is the team?
So our cutting and sewing is probably like 5 to 6 people. And
like we always do with this,
do like 50 to 100 a day. And that's just for gowns. I think for masks, it's probably a little more. I don't know that exact amount.
Here's one from Jack. So where can we find supply shortage numbers? In other words, how do you know where the need is? I know it's widespread. It's across the country. My sister is an ER nurse here in El Paso, and she and other healthcare workers in this community, even though we have not been hit especially hard yet. We have, I think, 120 confirmed cases. They're already beginning to ration the PPE because they know they're going to run out. How do you find out where you need to send this?
So we've been working with Med Supply Drive, which is the group of Georgetown med students who have been so amazing partnering with us. And so they're the ones that are also connecting with these hospitals. We've also, within the last couple of days, have just been getting DM requests and inbox messages asking, we need help here, we need help there, and, can you get it to us? So we're really just trying to utilize all those resources and just see what's the best, where is needed the most. Right now, because of the New York and what's happening, these next gowns tomorrow will be shipping directly to New York.
How many times can the PPE be used? Are these gowns washable? Can they be disinfected? Can they be reused?
Yeah, so we are, I actually have one here. Let me show you. So this gown is made out of a nylon fabrication. And as you can tell, it's very slick. So just think of windbreaker material. So they're able to, if any liquids, end up getting on them, they're able to wipe it off, and these can actually, just be thrown in the wash. It's not ideal. Medical grade PPE, you should be able to throw it away as soon as possible after, visiting patients. So we're really trying to focus on fabrications that are a or nylon ripstop, so that it's easy and light and flowy, and again, they're able to wipe it off on themselves.
So not strictly connected to coronavirus, but connected to the fact that that's a very fashionable gown that you produced. Material Guy wants to know, who are your fashion icons?
I would say my biggest fashion icon is my grandma Coco, who was born in Chihuahua, Mexico, and lived in El Paso her whole life. She taught me what it is to wear leopard and bright red lipstick and cobalt blue eyeliner, and that you can wear that every day of your life.
I love it. Maybe one of the last questions, and then I think we're going to introduce us to Mario. What's the average price? What does it cost you to produce a gown? What does it cost to produce a face mask?
Yeah, so right now, estimate is anywhere from, we can produce at least 2 to 3 face masks for about $5. And for gowns, it's anywhere from 1 to 2 for almost $10.
Great. And what are you hoping to raise? Do you have a goal that we can try to hit?
So we're almost we started at 5,000 and then we have a $10,000 goal, but we don't foresee this ending anytime soon. So we can keep going, and we want to keep going as long as we can. I know there'll definitely be a time limit on all of this, but just knowing that April is a very peak season, and we've been talking to hospitals in Detroit and Alabama and Florida, and they are, there's an SOS cry for help. So we just know, as long as we keep on getting the funds coming in, and any dollar donation amount is so helpful. I now know what $1, $3, it's as a grassroots campaign really means a lot. So.
Well, we want to help you. I mean, hopefully in part, everyone who's getting a chance to meet you for the first time, and then all of our mutual friends who I see their comments through the live feed are all going to take it upon themselves to click the link that's at the bottom of the screen. It's projectppeact.com. And I saw a question posed. I can't give money. What else can I do to help? Well, actually, everybody can give money, I think, who's watching this. I mean, even if it's $1, you can give that $1. If you truly can't, we understand, but I think almost everyone can. Give something. Kate says, can I donate from the UK?
I'm not sure.
Why not?
Yeah.
Why not?
Also, if you can't donate, I think it's just really important to help spread and share the message. It's been really amazing. I have to say, a lot of our early momentum, came from relationships that I have built during the last 2 years from campaigning. And so I'm really just thankful for all of you, for sharing, reposting, retweeting, and just on all social media platforms and donating. So thank you all.
So this is the flip side to the question about, can you take donations from the UK? Are you able to get this stuff to other countries? I'm assuming you want to satisfy the demand that you have here in the United States first, closest to home. But I like the sentiment of the question, which is, it's kind of one of the sad things about this, Jacqueline. The United States, if you think about our leadership in the world, since the Second World War, we've always led in the international response to a crisis or a tragedy or a global threat. And in so many ways right now, we're turning our backs on that global leadership, whether it's, climate change, which is perhaps the greatest long-term threat, or this immediate threat of COVID-19. We can't even take care of ourselves right now in this country if we were to rely solely on the government. And so I like the ambition in the question. Once you're able to solve this for all of us, Jacqueline, on the PPE needs in the U.S., can you help the rest of the world?
Yeah. Hey, never in my 15 years of being a designer, I thought I'd be doing this. So I think I'm in the right place.
I love it. Anything else that you want to tell us about, you told us that you're doing well. How are people in LA doing? How are the workers that you are with in this factory right now doing? Tell us what it's like there.
Yeah, I think, thankfully they just shut down, the actual beaches and trail parks here in Los Angeles, because it was getting a little worrisome the last 2 weeks where, people are now at home, but they've been, traveling to the beach and, going on these like amazing hikes, throughout the Getty and whatnot. And although that is just so amazing, it's just, I'm so happy that they're like, they have police officers out now guarding all that. Our friends, I think they're just thankful that they're able to keep busy right now and that they have somewhat of an income coming in. And they're also just, so happy to help those that are in need. Our face masks that we are making, we're also, trying to fill that gap of those donations. So we just sent over the weekend a bag to the Central Farm workers up in the Central Valley. And when you think about the farm workers who, a lot of them, this community was from Oaxaca, Mexico, and they're forced to work in these critical conditions, and yet they have zero PPE. So that is just something we're like really grateful for. And our workers are knowing that they're going to help, the farm workers or the homeless shelters and grocery stores and, women's shelters. Like it gives them pride too. So they're very grateful too.
Are understandably focused on the terrifying spread of coronavirus and the really heartbreaking stories that we are all reading or seeing, or maybe even know in our families of people who have succumbed to COVID-19. There's a lot of anger and frustration about our government's impotence in the face of this threat. And I think in the midst of all that, it's really important that we also find ways to be inspired and find reasons to be hopeful and optimistic. And when I learned about what you were doing, Jacqueline, I felt really inspired, and it made me feel like I've got to be able to do something too, I've got to be able to help Jacqueline, and we got to make sure that we elevate this and that she's able to raise money. I want to make sure that I'm volunteering more at the food bank here in El Paso. I want to make sure that I'm encouraging more people to do their part. We don't have to be the victims of this. We don't have to just take it. We have some agency and some control. And if stuff's not working out the way we want it to, then let's make it better on our own. And you said earlier that you're not one to ask for permission, but instead you ask for forgiveness. And really, as long as I've known you, you've asked for neither. You just get out there and do it. And I love that spirit, and we need more of that right now in this country. And so we will all be making donations, and we'd love to have you back on as you continue to ramp up, hire more garment workers, get more of this PPE out to more hospitals, and continue to be inspired. And that will cause each of us in our lives to try to match, the level of dedication that you have shown us. So really, really grateful that you were doing this, and really grateful that you'd spend some time with us.
Yes, thank you so much, Beto. It really means a lot.
Yeah, and we'll see you soon. Be safe and keep it up, and we'll check in down the road.
Okay, gracias.
Okay, adios. Bye, Jacqueline.
Bye.
Oh, that's got to make you so happy to know that Jacqueline is alive and doing what she's doing right now and helping all these good people who need it in the country and bringing really good people together. I think that's one of her magical powers. She always is having a great time, even as she's doing really tough or really necessary work. And I saw that again from the perspective as a candidate on a campaign. And now I'm seeing this as she successfully helps to confront this public health crisis in our country right now. So Jacqueline, please keep up the great work. And everyone, if you can, there's a link pinned at the bottom of this feed. It's Project Ppe.